to us and collaborators to present 0.7 microphaco with the AMO Sovereign Ice versus the Alcon legacy NeoSonix in white cataracts.
Good afternoon, Mr. Chairman, sir, ladies and gentlemen. Regards from BBI Foundation, Kolkata, India. Cataract surgery advancement has been on the incision size one aspect, 10 millimeters to sub 1 millimeter, which has decreased the post-operative inflammation. There's been less wound-related complications, less induced astigmatism, less surgical time, and early post-operative recovery. The aim of our study was to evaluate the potential advantages of the MICS using the latest generation ultrasound technology with a 0.7 millimeter incision, comparing the AMO Sovereign Ice versus the Alcon legacy NeoSonix. It was a prospective randomized case series. The participants were divided into two groups of 54 eyes each, and the cataract type was a white cataract. The age range was 55 to 72 years, no history of eye surgery or glaucoma, normal ultrasound findings, preoperative pupillary dilatation at least 7 millimeters, no pseudoexfoliation, central endothelial cell count greater than 2,000 cells per millimeter square, astigmatism less than 2 diopters, and informed consent was obtained. A full ophthalmic examination was done. Group A represented the Sovereign White Star with 0.7 millimeters incision, and the Group B, the Alcon NeoSonix legacy with 0.7 millimeters and 54 eyes in each patient. The preoperative and the anesthesia, all surgeries were done by the same surgeon under topical anesthesia with proparacaine, dilatation with tropicamide and phenylephrine. The IOL implantation in both groups was a Sensar IOL by a separate incision, limbal, temporal, 2.8 millimeters. The primary and the main outcome measures were studied. These were the mean endothelial cell count, the cell loss, the mean effective phaco time, the average phaco power, the central corneal thickness increase, and the volume of BSS used. In each case, a 0.7 millimeter incision was made. Trypan blue was used in all patients, and methylcellulose was used as a viscoelastic. Where required, high molecular weight viscoelastic was also used. The capsulorhexis was attempted to be between 5 and 6 millimeters. Rotation of the nucleus was done, and assessment of the incision size before and after the procedure was maintained. The nucleus management was a straight chop management, and anti-surge techniques were used so that the surge did not occur in either of the groups. The surgical parameters used in the study, the incision size 0.7 mm in both cases, both groups, capsulorhexis diameter between 5 and 6. The phacoemulsification tip was a straight tip and a direct chop nucleus management. Power settings between 30 and 80%, aspiration flow rate between 30 and 45, vacuum between 350 and 500, hyperpulse mode in the AMO Sovereign Ice, and the burst in the legacy NeoSonix. 500 millimeters of irrigation aspiration and aspiration of 40. The mean endothelial cell loss, the mean effective phaco time, and the average phaco power and the CCT increase showed a significant increase with the Alcon legacy NeoSonix, which was statistically significant. The post-operative outcome measures all visits, the uncorrected visual acuity, the best corrected, and the slit lamp examination done, and the specular microscopy and the corneal topography were recorded at the 3rd month. Complications, iris damage was seen in 3 patients in Group A and 4 patients in Group B. Corneal burn or posterior capsular rupture, zonular dehiscence, or endophthalmitis was reported in none. The decrease of the incision size has been one of the main evolutions in cataract surgery. The MICS or the phaconet is an excellent alternative for cataract removal. Significant difference between the two groups of the endothelial cell loss, the effective phaco time and the average phaco power, and the CCT increase was noted. The fallacy, of course, is a sub 1 millimeter IOL is not available. So we conclude by saying that 0.7 millimeter microphaco using the Sovereign Ice is more efficient and safe than the Alcon legacy NeoSonix, studying the visual outcomes, the endothelial cell loss, and the total phacoemulsification time. Thank you for your patient care.
Thank you. Now I call Dr. Hauselmans from Belgium to present first